we will discuss about the structure inside the pectoral region as well as inside axilla and front of the arm. So I already dissected the pectoral region, front of the arm and axilla. So first of all, I will show you the some structure inside the pectoral region. This is the pectoralis major. It is attached over here, but due to abduction of the arm, it is already cut from the lateral margin of the sternum from the second to sixth ribs, as well as it is attached to the anterior surface of the medial two-third of the clavicle, and it is inserted. This pectoralis major inserted into the lateral lip of the bicipital groove of the humerus. After reflections, here you can see this is pectoralis major. Before we will reflect the pectoralis major, you can see there is a skin, superficial fascia. After that, you can see the pectoral fascia, and over the pectoral fascia, just above to the pectoral fascia, retromammillary space. And after the pectoral fascia, you can see the pectoralis major, and after reflection of the pectoralis major, you can see there is a pectoralis minor which is attached to the third, fourth and fifth ribs, and it is attached to the this is the origin of the pectoralis minor over the third, fourth and fifth ribs, and it is inserted on the coracoid process of the scapula. The characteristic of the pectoralis minor, it is pierced by the medial pectoral nerve, and it is after that supplying to the medial pectoralis minor, it is also supplies to the pectoralis major. So the medial pectoral nerve which is pierced to the pectoralis minor and after also supplies to the pectoralis major. Above to the pectoralis minor, the muscles, it is called the above to the pectoralis minor, there is a between the clavicle and pectoralis minor there is a fascia, it is called the clavipectoral fascia, and this clavipectoral fascia which is pierced by the some structure, you can see this is the first vein, it is called the cephalic vein. Here you can see also this is cephalic vein. So cephalic vein, lateral pectoral nerve, and this is the axillary artery, and from this axillary artery thoracoacromial vessels, all this structure which is pierced to the clavipectoral fascia. The clavipectoral fascia also enclose the two muscles. Below it is enclosed to the pectoralis minor. Here at the upper level the fascia split and it encloses the pectoralis minor, and then it goes downwards. It is continues as a suspensory ligament, and it is attached to the axillary fascia, and it prevents the skin of the sagging downwards of the axilla. The above it is enclosed to the subclavius muscle, and this subclavius muscles after enclosing the anterior fascia, it is attached to the clavicle, and posterior fascia which is continues as a prevertebral fascia. Medially this fascia which is merged with the thoracic fascia as well as the intercostal muscles, and laterally it is goes inside the axilla and it is merged with the axillary fascia. Now we will discuss about the structure inside the axilla. Axilla, it is pyramidal in shape, and it is bounded anteriorly by the apex which is lies into the upper part, base on the lower part. This is the anterior surface of the axilla. This one is the posterior surface of the axilla. This is the medial surface of the axilla, and the lateral surface of the axilla which is very narrow. It is look like a border because the anterior surface and posterior surface which is converge, and it is very narrow. That's why the lateral surface it is look like a border. So the anterior surface of the axilla which is formed by the pectoral skin, superficial fascia, pectoral fascia, pectoralis major, pectoralis minor, as well as clavipectoral fascia which is forms the anterior boundary of the axilla. Posterior boundary of the axilla which is formed by the above to downwards. So just above to the scapula there is a subscapularis muscles, then teres minor, then teres major, and this latissimus dorsi. These are the muscles which makes the posterior boundary of the axilla. Medial boundary of the axilla which is formed by the upper 3 to 4 intercostal space, and it is covered by the intercostal muscles, as well as it is covered by the serratus anterior muscles. The lateral boundary of the axilla which is formed by the mainly the coracobrachialis muscles. Here you can see this is a coracobrachialis muscles, as well as the shaft of the humerus, where there is a anterior boundary of the axilla and posterior boundary of the axilla, which is converged, so it is very narrow. The content of the axilla, you can see there is a axillary vessels. This is the axillary vein and this is the axillary artery. Both are inside the axillary sheath, but we have removed the axillary sheath and separate the axillary vein and artery. As well as you can see there is a brachial plexus, cord of the brachial plexus, and some short branch of the brachial plexus which is lies inside the axilla, and also long branches, the initial part of the long branches which is also lies inside the axilla. Inside the axilla also presence of the axillary lymph node, 5 group of the axillary lymph node amongst the anterior, posterior, central, apical and lateral group of the axillary lymph nodes. So these are the content of the axilla. In short, you have to remember axillary vessels. So axillary vein and its tributaries, axillary artery and its branches, brachial plexus, mainly the cord and its branches which is lies inside the axilla and the axillary lymph nodes. Now I will show you the some structure inside the axilla. This is the axillary vein, and axillary vein which is there is a opening of the cephalic vein which is passes from the deltopectoral groove. This is the cephalic vein, whole cephalic vein, and it is along with it there is a lateral cutaneous nerve of the forearm. This is a lateral cutaneous nerve of forearm. It is a continuation of the musculocutaneous nerve. This is a musculocutaneous nerve. Here you can see this is a musculocutaneous nerve, and which is pierced to the coracobrachialis muscles. Now this is the axillary vein, this is the axillary artery. Now we will discuss about in short about the axillary artery. Axillary artery, it is the continuation of the subclavian artery at the outer border of the first rib, and which is a end at the lower border of the teres major. This is the, it become continuous as a anteriorly you cannot see the properly the teres major, but you can see the latissimus dorsi. So the it is at the lower border of the teres major. It is continuous as a brachial artery, and it is beginning at the outer border of the first rib, and it divided into the 3 parts by the pectoralis minor muscles. Proximal to the pectoralis minor, it is first part. Behind to the pectoralis minor, it is second part, and distal to the pectoralis minor, it is called the third part of the axillary artery. Axillary artery, it gives the totally 6 branches. Here you can see this is the very first small branch. It is superior thoracic artery. This superior thoracic artery, which is directly it supplies to the upper intercostal space and pectoralis minor muscles, and it is always lies upper border of the pectoralis minor muscles. Another branches into the second part of the axillary artery. It gives the 2 branches. Here you can see this is the artery which is goes on the lateral wall of the thorax. It is called the lateral thoracic artery. So this is the lateral thoracic artery, as well as this is the another branch of the axillary artery. It is the thoracoacromial artery, and this thoracoacromial artery divided into the 4 branches. It gives the pectoral branches, it gives the deltoid branches, it gives the acromial branches, and it gives the clavicular branches. So here you can see these are the 4 branches of the thoracoacromial vessels, acromial artery. So second part gives the 2 branches. One is the lateral thoracic and thoracoacromial artery, and third branch it gives the 3 branches. One is the smaller one which is goes anterior to the humerus, that's why it is called the anterior circumflex humeral. Larger one, it is a posterior circumflex humeral. It is goes along with the axillary nerve. This is the axillary nerve, and inside the quadrangular space. So posterior circumflex humeral, anterior circumflex humeral, and the largest branch of the axillary artery, it is a subscapular artery. It is on the posterior wall of the axilla, and it is along with the posterior axillary lymph node, and it gives the circumflex scapular artery. And this circumflex scapular artery, which makes it is lies inside the upper triangular space. So total 6 branches of the axillary artery, and after that it becomes continuous as a brachial artery inside the brachium. Brachium means arm. So The brachial artery, now we will discuss about the brachial artery. It is lies inside the arm, particularly between the biceps and brachialis muscles. So axillary artery, brachial artery, it starts from the lower border of the teres major, and it is inside. It is end inside the. It is end inside the cubital fossa. It divides into the two branches. One branch is, it is called the radial artery, and other one, it is the larger one, it is called the ulnar artery. So inside the cubital fossa, the brachial artery, it is end by terminating the two branches, radial and ulnar artery, and it begin at the lower border of the teres major. After entering into the upper part, it gives the first branch, it is called the it gives the profunda brachii artery. This profunda brachii, it is along with the radial nerve, and it is enter inside the lower triangular space inside the spiral groove of the humerus. After that, the brachial artery, it gives the muscular branches. These are the muscular branches of the brachial artery. Here it gives the one superior ulnar collateral branches, which is pass along with the ulnar nerve. This is the ulnar nerve. So this one is the superior ulnar collateral artery, and the most lower one, it is the lower side, it is the inferior ulnar collateral artery. And last one, this brachial artery divide into the radial and ulnar artery. So here you can see this is a radial artery and this one is a ulnar artery. So brachial artery, mainly you have to remember the median nerve which is cross from lateral to medial side. So the median nerve which is crosses the brachial artery from lateral to medial sides, and so inside the cubital fossa, the structure from medial to lateral are the first structure, it is a median nerve. After that, there is a brachial artery, then there is a biceps tendon, and then the most laterally, here you can see there is a superficial branch of the radial nerve. So here you can see this is a superficial branch of the radial nerve. So these are the structure from medial to lateral inside the cubital fossa. So this is about the brachial artery. Now we will discuss about the branches of the lateral cord of the brachial plexus. This is the lateral cord of the brachial plexus, and I will show you the branches of the lateral cord. You have to remember LML. L means lateral pectoral nerve, which is pierced to the clavipectoral fascia, and it supplies to the pectoralis minor and major, and it is communicated also with the medial pectoral nerve. Another branches of the lateral cord, here you can see these are the continuation of this lateral cord. This is the lateral root of median nerve, and these both are the lateral root of median nerve, and it makes the median nerve. And another branch, it is continuous laterally, and it pierces to the coracobrachialis. It is a musculocutaneous nerve. So median nerve, which is formed by the lateral root of lateral cord and medial root of medial cord, it both are combined, and it makes the median nerve. And median nerve, mainly you have to remember, it crosses the brachial artery from lateral to medial sides inside the inside the arm, and inside the cubital fossa. The median nerve lies most medial to the brachial artery, even medial to the brachial artery. And this median nerve, which ultimately inside the forearm, it pierces to the one muscles, it is called it pierces to the pronator teres. This is a pronator teres, which is pierced by the median nerve. So here you can see this median nerve which pierces to the pronator teres, and it enters inside the forearm, and particularly it supplies to the flexor muscles of the forearm, except flexor carpi ulnaris and flexor digitorum profundus of the medial half, which is supplied by the ulnar nerve. Remaining all the muscles of the flexor compartment of the forearm, which is innervated by the median nerve. So we already discussed the three branches of the lateral cord. It is a lateral pectoral, lateral root of median nerve, and musculocutaneous. This musculocutaneous, which supplies to the, it pierces to the coracobrachialis. After it pierces to the coracobrachialis, it passes between the biceps and brachialis, and lateral to the brachial artery and median nerve, and it also supplies to the biceps as well as brachialis. After that, it becomes the cutaneous inside the cubital foci, pierce to the deep fascia, and it becomes the lateral cutaneous nerve of the forearm, and it is along with the cephalic vein. You have to remember, and it supplies the skin over the lateral aspect of the forearm. So it is a musculocutaneous nerve. Now we will discuss about the branches of the medial cord of the brachial plexus. This is the medial cord of the brachial plexus. This medial cord of the brachial plexus, it gives the first branch. Here you can see this first branch. Here, this is the on that side. Here you can see this is the first branch, which is the medial cutaneous nerve of the arm. This medial cutaneous nerve of the arm, which communicate with the intercostobrachial nerve, and this supplies to the skin of the axilla, as well as it supplies the skin of the medial side of the arm. So this is the first nerve. It is a medial cutaneous nerve of the arm which communicated with the intercostobrachial nerve, and it supplies to the skin of the axilla as well as the medial side of the arm. After that, the medial cord, which gives the another branches. Here I will keep the forceps over the medial cord, and this nerve, it is a medial cutaneous nerve of the forearm, and this medial cutaneous nerve of the forearm, at the elbow level, it divides into the anterior and posterior division. The posterior division mainly it is along with the basilic vein. This is the basilic vein, and the anterior division along with the median cubital veins. The third nerve of the medial cord, it is a medial cutaneous medial root of median nerve, and it makes the median nerve. And the fourth nerve of the medial cord, it is the this one is the medial pectoral, and this medial pectoral, which pierces to the pectoralis minor, communicated with the lateral pectoral nerve, and it supplies to the pectoralis minor as well as pectoralis major muscles. And the last nerve of the medial cord, it is the largest nerve. It is a radial nerve, and this radial nerve, which enter inside the arm, and it pierces to the medial intermuscular septum along with the one artery. It is the superior ulnar collateral artery, and it is enter behind to the medial epicondyle, and then it enter inside the medial side of the front of the arm deep to the pronator teres muscles. So there are 5 branches of the medial cord. We already discussed. This is the medial cutaneous nerve of the arm. Second one is the medial cutaneous nerve of the forearm. Third one is the medial root of median nerve, and it is joined with the lateral root of lateral cord, and it makes a medial cord. And the fourth one is the medial pectoral nerve, and the fifth one is the largest branch of the medial cord. It is the ulnar nerve, and this ulnar nerve, which is passes along with the superior ulnar collateral artery, and this ulnar nerve, which is enter just behind to the medial epicondyle of the humerus, and then it is enter inside the flexor compartment deep to the pronator teres, and it supplies inside the forearm, particularly flexor carpi ulnaris and medial half of the flexor digitorum profundus, and particularly ulnar nerve supplies to the all intrinsic muscle, 15 intrinsic muscles, which is supplied by the ulnar nerve. That's why ulnar nerve, it is called the musician nerve. And the last branch of the last cord, it is a posterior cord, and this posterior cord, the first branch, here you can see this is a upper subscapular, and this upper subscapular supplies to the upper part of the subscapularis. This is the nerve to latissimus dorsi, which supplies to the latissimus dorsi. And third branch, it is the lower subscapular. This is the lower subscapular, which supplies to the lower part of the subscapularis as well as teres minor muscles. Fourth one is the nerve which is enter inside the quadrangular space into the scapula, scapular region. It is the axillary nerve, and this axillary nerve supplies to the teres minor and deltoid muscles. And the last nerve of the posterior cord, it is a continuation of the posterior cord. It is the radial nerve, and this here you can see this is the radial nerve, and this radial nerve enter inside the spiral groove along with the profunda brachii artery. So this is a profunda brachii artery and this is a radial nerve. It enter inside the lower triangular space. So these are the 5 branches of the posterior cord. Again we will discuss the 5 branches. I will show you the first one. It is the upper subscapular, then now to latissimus dorsi, and then you can see this is the nerve which is the it is a lower subscapular, and then axillary nerve, and the last one it is a continuation of the posterior cord. It is a radial nerve. So these are the structure you can see inside the axilla. Also you can see inside the axilla this is the nerve to serratus anterior, and it is directly branch of the root of the C5, C6 and C7. It supplies to the serratus anterior. One nerve which is directly goes on the back side. Here you can see this is a suprascapular nerve, and this suprascapular nerve it supplies to the supraspinatus as well as the infraspinatus muscles. So this is the about to the axilla as well as pectoral region and the axillary artery and brachial artery. Hope you enjoy the lecture. Thank you very much.